Welcome to another episode of The Brand Called You, a podcast and podcast show that brings you leadership lessons, knowledge, experience, and wisdom from thousands of successful individuals from around the world. I'm your host, Ashutosh Garg, and today I'm delighted to welcome a very, very senior and accomplished medical doctor from Bangalore, India, Dr. Sanghmitra Dasgupta. Sanghmitra, welcome to the show.
Thank you so much, Ashutosh. Pleasure to be here.
Thank you. Dr. Dasgupta is the director of CORE, CORE, which is for dental, face, and hair care. She specializes in oral and maxillofacial surgery, implants, cosmetic dentistry, and laser dentistry. And she's also a globally renowned surgeon and probably the only bioengineer in India who uses dentistry to solve major structural and health issues. My goodness, you seem to have achieved everything that was possible. So before we get into anything to do with dentistry, tell me a little bit about your own journey.
So let me begin with the place I come from. I'm born and raised in Shimla, that's in Himachal. And I grew up like a happy-go-lucky child, very average student. I think most of my schooling I spent outside the class than inside the class, And my dad was a surgeon and I have a brother, he wanted my brother to be an engineer and me a doctor. My brother joined forces, he's an army officer. And me being an average student, it was next to impossible to be a med student. And at the same time, I definitely wanted to be anything but a doctor because I loved my father so much that I hardly saw him at home, So I always put my hands up. I said, no, not a doctor, anything else would do. So finally, when it was time to choose a career, then we decided that, okay, let's look for an option, a smart option. And I said, okay, I want to be a pilot. Came to Bangalore. And here, my dad meets a friend, an IAS officer from Himachal. And then he tells my dad, Dr. Sahab, looks like you don't love your children. So he's like, why do you say that? And he said, your son is in army and you want to send your daughter and you want her to be a pilot. And dad said, she doesn't want to be a doctor and moreover, she doesn't have good grades. So what should I do? Said, you know what, there are a lot of dental schools in Karnataka. Why don't you put her in one of the dental schools? And it's a 9-to-5 job. It's a pushy job and, all of that. And then Dad put his foot down. He said, you have to be. And then he was inside very happy that there will be a tag of doctor in front of my name, Yes. So I joined dentistry with not so happy the mindset. A couple of years went by and then I found it very creative and suddenly I was interested in it. Okay. And I did my master's in maxillofacial surgery. So while I was doing my postgrad, we had a prof come down from Germany, Professor Graffelman. He was one of the pioneers of implant dentistry world over. And I had a chance to assist him in some of the cases. And he said, you know what, girl, you have good hands. I would like to train you. Why don't you come to Germany once you finish? I finished my postgrad and then I went to Germany. I learned the implantology from him. And while learning, he said, a couple of things which he said was very interesting. He said, I'm scared of surgeons placing the implants. I said, Prof, why do you say that? You know what, do you know the similarity between an implantologist and a dog? I just looked at him. You know what, both love bone. So, I say, yeah. He said, wherever the surgeons find bone, they just go ahead and put the implant there, but the implantology doesn't work like that. So implant is not a tooth replacement, implant is a root replacement. You have to put in such a way that it can receive the crown in comfortable way that the patient can chew on. And now I did my postgrad in surgery and I hardly knew anything about teeth. Now it was, if I had to pursue implantology, it meant that, I learned dentistry. I came back to India. We decided to settle in Bangalore and I was teaching in a dental school as well. I was an assistant professor then. So I decided that if I have to do dentistry, working in a college wouldn't work, because I've learned so much. Then we started a dental clinic. I started the dental clinic, but I didn't know anything about dentistry. Then I went to met some of the, the speakers, very good speakers in the conferences, and I requested them that, can I come and watch you? And this, I decided to go to Mumbai. I went to a couple of clinics and I was not happy at all. That run-of-the-mill kind of dentistry.
Right.
The sterilization protocols were pathetic. They were kind where they dipped instruments in hot water and used. Some of the dentists used the one pair of gloves for all the patients throughout the day. I said, no, this is not happening. I don't think, I can work like that.
Yeah.
And then it so happened somebody suggested, no, there is a Dr. Shetty in Mumbai, and why don't you go and check out? I said, okay. I went there and I just loved the way he worked. He was wearing the surgical loops, 3X loops, and surgical protocols were in place. I said, yes, this is where I want to learn. So I learned a lot of dentistry from him. And the added advantage was, like what my professor has suggested, that for the implantology to succeed, you have to know occlusion. Now, what is an occlusion? The way our teeth meet, the way they fit into one another. So if that is perfect and the forces are correct. Now, forces, when it came to forces, I had physics in my mind. I said, Mar gaya. Now what? I have to learn the physics as well. But since I was very keen on learning all this, everything fell in place. Dr. Shetty taught me, and he was the authority on occlusion. So he has been my mentor all through, and he taught me a lot of dentistry and a very ethical dentistry. So that's how my journey began.
Amazing. What an amazing journey. And, from being a reluctant dentist to being such a well-known and respected dentist, full marks to you on this amazing journey. So let me then ask you that, you use several of terms like occlusion, which I don't understand. So pardon me if I use the wrong terminology.
No problem.
But what are some of the common structural and health issues you see in patients? And how does dentistry help to address these?
So let me explain. Now, this is, how the dentistry evolved over the years. Let me start with that. See, earlier, I think maybe in the 70s or 80s, when anybody had toothache, they would go to the dentist. And if the tooth can be filled, they filled it, or they pulled it out. Okay. So how we evolved, then over a period, then the root canal process started. Then with the root canal, it was essential that we do crowns. Okay. And then over the years, implantology happened. Implantology was the game changer. That's when the surgical protocol in all over the clinics, that they fell in place. And then the occlusion. Now, occlusion is like when your upper end, you bring your teeth together. Okay, the way upper jaw teeth and the lower jaw teeth meet one another, that is what is called as occlusion.
Okay.
Now, this is the most important part, which made a difference in my entire science that I created. Okay. So if anybody has a cavity, how does the cavity happen? We always say that don't eat sweet, that's how you get cavities. Actually, enamel it has a tile finish. It doesn't have any cracks. And please remember, enamel is a second hardest stuff after diamond.
Wow.
So, to crack an enamel, it takes ever so long. So what happens 24/7, it's not the eating which causes actually the cavity. It only hastens the process of cavity formation. But the crack line forms on the teeth is by the occlusion forces, by the forces we generate. And when do the teeth come maximum in contact? Every 3 minutes we swallow. We swallow, you see?
Yeah.
That's when the teeth come in contact. Okay. So every 3 minutes it's happening. Only time it slows down when we are sleeping. But that time also we swallow. So that's the time teeth come in contact. So if our muscle forces are too much, that means there will be a crack or a break in the continuity of the enamel. And in that break, if you don't maintain hygiene, then the food collects and the cavity process starts. So You see how everything has a reason, you know? It's just like that, it doesn't happen. So now, and some people develop gum diseases. Now, how do they develop gum diseases? So gum disease is like when the occlusal forces are high. See, our body's defense mechanism is such that, you know, the body will always try to protect you. So when the occlusal forces are more, our muscles are, you know, they are clenchers, and we generate much more forces than the teeth can withstand. Either the teeth are going to crack, or the supporting structure of the tooth is going to get affected. So then the gums get inflamed, bone starts moving away, and the teeth start shaking. So that's how the gum disease develops. Okay. So having understood this, then we realize, okay, is it that only the inside part it is affecting? Then we found out, till that time, the science was only till joint. This is called as the joint. When you open and close our mouth, if you put your fingers in front of the ear, there is a joint. Okay? This is a universal joint. Yes, open anytime you're eating, you're talking, this is a joint. So this joint also, we thought like, okay, this occlusal disease causes problem in this joint. So, and then we found out the migraines or the neck pain was also associated with. So our knowledge was restricted till then. So the occlusal disease was the main culprit. Now, how do you deal with that? So we made, there are world over, you know, a lot of, we call this as splints or deprogrammer. I practically tried all the possible deprogrammer which are available in the world. And some worked, some did not. And it was very painful to, you know, when the patients got into more problem. So I knew that something more is associated with that.
Right.
Then we found out, then I started an year, I think it was 2012. So I had a trainer, you know, he was a physiotherapist, and he had an enormous knowledge of muscles. He used to teach me a lot about muscles. So then one time, it so happened, I saw, he always used to tell me that the core muscles have to be super strong if you have to be, you know, a stronger person. And then I see a person lifting weight. So I asked him, I said, Ben, should your teeth come in contact when you're lifting weight? He said, no, only the core muscles, no teeth coming in contact. But I said, you know what? I see most of your clients, when they lift weight, they also clench their teeth.
Right.
There is some connection that, you know, there is you know, they are generating power from the jaw. He said, no, I mean, I don't blame him. He did this. Then I started chasing it. And then I found out that, yes, there is a connection. Like if you see a mother, when she's delivering a baby, okay, what does she do? She clenches her teeth to push the baby.
Correct.
Right?
Correct.
A person is constipated. What do? You clench your teeth to push, right?
Correct.
So that means there is a connection. So now I started chasing this connection. And that's when I found out that, you know, it's so beautiful, Ashutosh. We don't even give any importance to baby teeth. Okay. You have children, right, Ashutosh?
Yeah.
Okay.
But grown up.
Grown up. Okay. So maybe when
I have a granddaughter now. So.
All right. So how old is your granddaughter?
She's now will be 9 months.
9 months. Okay. Long way to go. Okay. So when she's 6 or 7 years old, you will think that the permanent teeth start coming in. We always think that it's the front teeth that come first, right? But actually that's not correct. It is, we have the first molar tooth, sixth tooth. That comes first in the mouth. Now, why should that happen? Okay, there's a reason for it. Now, our spine formation gets completed by the time we are 6 to 7 years old. And now the spine needs stability. Okay, and that stability is provided by the sixth tooth coming in contact. It has a large surface area. It's like a tent pole. You know, spine is like this, and the tent pole is provided by the jaw muscles. So this happens to the neck area. Okay, cervical spine. So cervical spine or the neck spine is actually stabilized by our jaw muscle and the neck muscles. So having learned that, I found out that it has a lot of implication on the posture.
Okay.
Now, if the lower jaw six tooth, now the jaw that you please move your jaw, you will find out only the lower jaw moves. I can do this, but I can't move my upper jaw. Upper jaw is fixed. Okay? Upper jaw is fixed to the brain part of the skull. So the jaw has a six tooth, like I told you that it is connected to the cervical spine. So this six tooth, how it meets the six tooth of the upper jaw actually dictates the posture.
Okay.
If the lower jaw is behind the upper jaw, head will fall forward. You see that? And if the lower jaw is ahead, the head will fall backwards. We call it lordosis. You know how lords would walk with the head held high? So this is the basic science behind it.
Amazing.
So we used to work around that, but still we didn't have much success. You know, somewhere some failure was happening. Then it so happened in 2017, a lady from Budapest came for a conference, and she spoke about that, you know, the jaw can, the asymmetry happens when the lower jaw rotates to one side. It's fantastic. Now my jigsaw puzzle was, you know, kind of sorted. So now I realized that, you know, Devanand, the yesteryears, he could never keep his head straight. Why do you think he could never keep his head straight? It was because the muscles of one side would pull it to such a way that his head, even if he tried, his head would fall to one side. Okay, none of us are symmetrical. There's an 80-20 ratio. As long as 80% we are symmetrical, we are good to go. But if this, you know, the percentage little bit moves here and there, then the medical problems start.
Amazing.
Now what? I hope I'm not.
No, good, right? I want to move to a few more questions because we are running out of time now. So
okay. So yeah. So
but please go ahead. Please go ahead.
All right. So the ailment. Now, very quickly, I'll tell you. So this is basically I wanted to explain to you how it goes about it.
Yeah.
And then what are the implications it has? It can cause headache. It can cause neck pain. It can we have in the throat. We have our master, the very important gland called thyroid gland. So thyroid gland, it can affect, it's a thermoregulator, temperature regulator. Then we have a wind pipe, we breathe, okay? Then we have food pipe, so it can affect acidity, it can cause shoulder pain. So all these problems are associated with the if you have teeth issue, if the occlusion is not correct.
Very interesting. Very, very fascinating. So my next question to you, Sanghmitra, is that, you know, when it comes to patients, and you know what you've just told me is so educative. You know, I mean, I didn't know a lot of these things. You know, even though I go to my dentist very regularly, but how important is patient education and communication in your work?
Most important. You know, Ashutosh, I do this bioengineering, as you mentioned about it. So it takes a long time. Every patient, I practically spend almost 2 hours with one patient.
Wow.
Okay? So I don't see more than 5 or 6 patients a day. And my practice has been built by my patients. Such a beautiful thing to happen, right?
Yeah.
So I spend a lot of time with my patients. My patients are my family. I educate them like what you said that you learned. I think my patients know so much more than they go out and educate people. You know, they always say, "Oh, you have a headache, don't take pills. Maybe you should go to Sanghmitra and check it out if you know it is because of the occlusal disease, or you know your muscles are fired up. It's happening because of that." Yeah.
Very interesting. The other thing that is often, you know, asked about people who are, you know, professionals like you, is that how do you work to ensure that your patients understand the importance of dental care and overall health and wellness? Because someone was telling me that our teeth are also an area where we could probably, you know, that could probably lead to a lot of problems for our whole body.
I would like to correct you, not just could. They are majorly responsible for, because see, I told you enamel is second hardest after diamond. Correct. So the amount of mineral which the mouth has, and they are arranged in an arc. See, there's so much physics here, right? So the principle of arc is the strongest principle, engineering principle. So then the teeth, when you lose a tooth, you lose your strength, your muscle forces come down, you know. I can go on and on, but then, since we are short of time, so yeah, so I think I like to stop here. Yeah,
No, so I'm with you entirely, and I think this whole thing of understanding our teeth and the importance of making sure that our health is protected through because of our teeth is so important. But I also wanted to ask you a little bit about cosmetic dentistry.
Yeah.
I believe this is growing very rapidly, but what is the reason and where do you see it going?
Yeah, Ashutosh, years we put, if at all we went for the filling, we put that mercury filling. Okay. And the mercury, if it breaks, it goes into your system. It is known to cause a lot of health hazards.
Correct.
So the materials are evolving by the day. You blink your eyelid and there's a new material in the market, And then you have earlier years we used a lot of metal crowns. They contain nickel. Nickel is carcinogenic.
Wow.
Cancer causing. Okay. So it was very important that we moved away from these materials. Okay. So that's when we had tooth colored. Now you can't possibly put a black material, right?
Correct.
So you have to put a tooth color. So now we have ceramic tooth colored with different shades and stuff. So this is what if it is actually why we call it cosmetic is I always wonder, because if you have to restore it and you have to give it tooth color, so that's how it becomes cosmetic. But if you're asking me about the smile designing, yes, it's Ashutosh, we live in a feel good and look good era, right? So we always wanting to enhance our appearances, look confident and all of that. So smile designing has become quite a rage these days, and people do go for smile designing. But if you ask me, am I a smile designer? The answer is no. Whenever somebody comes to me, it's situational. See, if it's a small, if the mouth is absolutely fine, and then they want to have the smile design, I'm happy to do it. Okay. But I'm a functional dentist. I always believe that when I align your muscles, we never smile with teeth. We always smile with eyes.
Correct.
And when we do that, when our muscles are aligned, when the eyes are open, when they're twinkling, I think that's the best smile. So I always tell them, a lot of people, my lip is not going up, I say, because there is an asymmetry. Your muscles are not coordinated. That's why you have a problem. It has nothing to do with the teeth.
Correct.
And especially women, boy, it's so difficult to explain to them that it's not because of teeth, it's because of so they go about Botox and fillers. I always tell them everything has its place. You want to enhance your looks, you go for it, but you align your muscles and nerves of the body, your spine is in alignment, you are sorted. You look 10 years younger, your basic metabolic rate will improve, your health will improve, you're looking brighter, you're breathing better, you're glowing. So that's how it works.
Correct. Well said.
Yeah.
I have time for two more questions.
Yes.
I also wanted to ask you, given the amount of work that you have done and you've trained with some of the best in the world.
Yes.
What are some of the current innovations in the field of dentistry that you are particularly excited about?
I'm most excited about, there are three things. Implants, which I already explained, game changer.
Yeah.
Laser dentistry. With laser dentistry, I think I did only in my entire career, I think I must have done some 3 or 4 gum surgeries, Ashutosh. I treat every case with laser and I work on the crucial part of it, and the patient is all sorted.
Okay.
So, we used to do earlier a lot of destruction, pull out and destroy and give, pull out all the teeth, give dentures and all of that. Now we are working on preserving. We preserve is the mantra.
Correct.
So innovations are actually working around that. And even, people are working with stem cells. And actually, it's like this, you have cavities and they inject and, the enamel regrows. See, enamel, the thing is, with the enamel is the only thing in the body, once you lose it, you lost it forever.
Okay.
But there's science that's working towards whether we can regrow enamel with the stem cells. But
Okay.
at this moment, they're not able to control the size. Sometimes the peanut size, sometimes the football size. So that's what is happening. I think that would be the innovation that I would like to see in my lifetime.
Amazing, amazing.
And now in dentistry, so yes, I want every dentist to take over. Don't be a dental surgeon, be a dental physician. I call my presentation teeth to feet because I'm able to sort out people from head to toe.
Amazing, amazing. And my last question to you, and this is for the thousands of people who will watch our conversation, based on your own amazing journey,
Yes.
what would you say are 3 lessons for our health that you would want us, our viewers and listeners, to take away?
As a dentist, I'm going to be dentistry specific.
Absolutely.
Okay. Don't think that baby teeth. A lot of people don't give any importance to baby teeth. Okay? Baby teeth lay the foundation of how your permanent teeth are going to come.
Correct.
Baby teeth are very important for the integrity of your spine.
Correct.
So the most important, first and foremost, most important is that the regular visit to a dentist. And when I say dentist, it's like the one who knows the stuff, not just any dentist. And, we are not talking here about drilling, filling and all that stuff. We are talking about the structure for your overall health. Okay, I have a lot of kids about age 6 to 7 year old. Parents didn't even know they were sleep apneic. Ashutosh, I've treated them, and the kids are performing better in grades. They're sleeping better. Their health is better. So that's one part takeaway from here. Secondly, even for us, we always go to the dentist in the last minute when the tooth is aching, right? Go for the regular visit. It's so important. It's just not the mouth.
Yeah.
It's not the smile. It's your overall health. So that is second. Third is, if you have any ailment in the body, consider visiting a dentist like me. The tribe is growing. Who knows about it? Who can work without medicine and without surgery and give you a solution to your medical ailment? Yeah, if the time permits, I would like to tell you my story.
Please, yeah.
What happened to me?
Yeah, please tell me.
In 2019. I was walking my dog in the park, and I suddenly realized that I couldn't breathe. So I went to the pulmonologist, and he said that, I was a little late, about a month late going to the pulmonologist. That's how we are, right? That's how I treat all sorts of things. He said I had pneumonia.
Wow.
Okay, and if I was late by a week, my lungs would have fibrosed and all of that. So later, I was put on steroids. I had put on a lot of weight. And then later, anyway, that was the wrong diagnosis. It was actually an autoimmune disorder, wherein all the muscles from head to toe get inflamed. Okay. And I felt crippled, Ashutosh. I couldn't even get up from the chair. I was that bad. And then I went through the therapy, and then they put me on immunosuppressive medicine, which I was supposed to take lifelong. Okay. There was a little damage in this one, but overall okay. I felt good, but at the same time, I don't like taking medicines, So and my blood pressure started acting up. So I said, no, I will not continue this immunosuppressive medicine. And the COVID time, you're supposed to have your good immunity. And here I was on immunosuppressive. So then I went through this. I completed the treatment, and I told my husband, he's also a dentist. I said, COVID time, not many patients. I have to walk the talk. I sort out a whole lot of my patients. So can you do the treatment for me? He said, I'm an orthodontist. I can't. I said, no, I will guide you. And actually, he did the treatment which I do for the patients. And, I felt that my muscles regained the strength. Now I do my yoga. You won't believe, in Padmasana, I can sit for 10 minutes.
Amazing.
I can squat for 10 minutes. I mean, nothing happens to me. I'm so flexible. So I have seen, that has been my journey, that how it has worked for me. So, the third takeaway, which I've been talking about, is that please consider that without surgery, there is a solution with us.
Amazing. Amazing. And on that note, Sanghmitra, and your amazing lessons, which is so powerful, don't ignore baby teeth, because they are really the foundation of everything that we will be when we grow up. Go for regular visits to the dentist, and for any ailment that you have, remember that there is always an option without medicines, etc.
And don't forget children.
And don't forget children, absolutely. Thank you so much for talking to me. I mean, I think my conversation with you has been a complete eye-opener. As far as our teeth are concerned, as far as the dentist is concerned, and as far as, a better understanding of how important our teeth are for our overall health, for our general health.
Yes.
I had never ever thought that, when we are using any pressure, we clench our teeth. But as you were talking, I was thinking, and I think it was an amazing 101 on understanding our teeth. Thank you so much for speaking to me, and good luck to you.
Absolute pleasure being here. Thank you, Ashutosh. Thank you so much.
Thank you for listening to the Brand Called You videocast and podcast, a platform that brings you knowledge, experience, and wisdom of hundreds of successful individuals from around the world. Do visit our website www.tbcy.in to watch and listen to the stories of many more individuals. You can also follow us on YouTube, Facebook, Instagram, and Twitter. Just search for the Brand Called You.